Permanent paralysis related to traumatic motor vehicle injury. Nursing 442, my name is Alexis Hawk. Today I'm discussing a patient. It's an 18-year-old Caucasian female with a middle-class upbringing. She's a single patient living with her mother, stepfather, and two stepbrothers ages 6 and 8. She has Kaiser Health Insurance under her mother, and that is what she is using along with Medi-Cal, I believe. The patient's primary medical diagnosis was a C4 through C6 complete fracture with stabilization and fusion. Because the patient has permanent paralysis from the nipple line down, the primary pharmacologic intervention was steroid therapy. However, she will face long-term issues with chronic pain. Self-care capacity. She's currently mostly dependent upon others for self-care. She's in the self-realization phase of her life and trying to gain the necessary confidence in her inpatient rehab to gain her self-care abilities back for a more normal capacity of self-sufficient ADLs. The specific self-management skills that will be required for the treatment and rehab are going to be important for the patient to have good time management, especially when she's out of rehabilitation, to keep on her schedule of follow-up appointments and meetings. Additionally, establishing goals with the nurse or case manager looking after her case once she's out of the acute care facility will be imperative for her to have a continued amount of success. Priority issues for discharge. Rehab, obviously multiple phases of rehab. She's going to need durable medical equipment for home use. She's going to need home health nursing to help her mother learn whatever skills she may need. She's going to need a psychiatric review because she's now depressed because of her injury and her age and stage of life, and her peer relationships. She will need to be transitioned in multiple stages. She is currently at the Rehabilitation for Neurological Injuries in Craig, Colorado. She's going to need home health care. She's going to need assistance at home with outpatient rehabilitation as her mom has a job and she can no longer drive. And she will need to be involved in support groups. The primary nursing case management level is supporting and empowering patient transitions. Self-management is the most effective way of managing chronic conditions. Evidence-based practice has shown self-management is the most effective way of managing chronic conditions. The Stanford Patient Education Research Center has been developing and evaluating community-based programs for the management of chronic conditions. And their research has shown that self-management interventions were the most effective in helping patients with their coping skills and ADLs. Self-management is the key for empowering the patient. In the case of this patient, it's imperative she is afforded the ability and the support for self-management. There is the FOCUS study, which involves family involvement, optimistic attitude, coping, effectiveness, uncertainty reduction, and symptom management, which is all going to be necessary for this patient to continue her recovery, as she will need her family for that. At the system level, the transitions of care are going to be important, including the family during the transitions of care are going to be important. Partnering with all the other facilities are going to be all equally important. Intervention for the patient level nursing case management strategy is going to be using the FOCUS model. It fosters optimism and coping, and it involves the entire family instead of just the patient themselves. For the nursing case management for the system, you're going to need to have assessments at each level of care, thorough assessments, to ensure that the patient is receiving the appropriate care for the level of rehabilitation she is in. Utilization review. You're going to have primary and specialty care. You're going to have supportive and transitional care. You're going to have sometimes acute care, depending on if she gets any infections. Quality and safety. One of the most important areas for safety is going to be the continuity of care between the transitions and the patients. Adequate communication between the case management in each facility will need to keep the lines of communication open. All in all, communication is the key here to providing this patient with the best care possible.